Hi, welcome back to my YouTube channel. This is my third video and my midterm for conversation. This video we will not discuss with the K-pop songs, but we discuss again about the case study. Case study with title False Treatment of Mentally Ill. Check this out for the content case study. Case Study 12 False Treatment of the Mentally Ill. Mr. Mr, Miss FC, and Miss FG had been involuntarily committed to a psychiatric center. Each was being retained pursuant to orders of the local country court, which had found them to be persons in need of the involuntary care and treatment, in that they have a mental illness for which care and treatment as a patient in a hospital is essential to their welfare, and their judgment is so impaired that they are unable to understand the need for such care and treatment. These patients refused to be medicated with antipsychotic drugs. Their objections were overruled, and they were subsequently medicated with various antipsychotic drugs. Mr. Mr and Miss FC thereafter commenced a declaratory judgment action against the commissioner and official of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and a declaration of their common law and constitutional right to refuse medication. Miss FG refused treatment with antipsychotic drugs, but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violated her common law and constitutional right to determine her own course of treatment. The question is, should the hospital allow mentally ill patients to determine their own course of treatment? My answer is yes, because the hospital medical authorities must know the patient condition, such as the economic patient may be constrained, so afraid to not be able to pay for treatment, which either has to be until when. 2. Basically, who has a drug allergy. And more important is someone who has a mental illness. They have a mental disorder, but their physical and social health is fine. Mental illness or mental disorder is not the same crazy. They experience psychiatric disorder, but well-being, realize their potential to productive things. Before entering the treatment of mental illness, we must know how do we know that we or someone has a mental illness. Someone we feel mental disorder, but not in the near term, 1 or 2 days or the same times, but it can be up to 2 months or more, to realize that there is a psychiatric disorder in themselves, and must be diagnosed by a third person, a professional person, that is psychology and psychiatry, because the mental illness is a various types of bipolar, schizophrenia, obsessive compulsive disorder, anxiety, and others. Therapy for mental illness by psychology will be treatment with an example of making diary, write what is felt. If there is a conflict, it must make the solution, and it must be demonstrated when the next check-up. In addition to a psychology, can also go to a psychiatric. In psychiatric, patient will be given to consume the drug, where the drug help to stabilize, reduce anxiety, can sleep blissful, and others. Because by taking the drug and consultation with psychiatry, there are some patients whose side effect of the drug are economic consultation because the cost is more expensive. All treatment can work well if the patient can be obedient and have support system of family, friends, or close friends, and don't ever stay away from someone who has mental illness. Should we know, we should be able to understand them. Okay, that's my opinion and the result of my search for mental illness. Hopefully can answer the question and provide knowledge for all who watch this video.